Hi, everyone. It is a pleasure to be here with you. Um, I am Dr. Ariel Ostad, and uh, I am so grateful that you were able to join us. I hope you're all doing well. I know it's trying times, and I know it's challenging with everything that we're dealing with, but I chose to do this webinar as a means of, again, connecting with you all. I love what I do. I love to be able to see you all in my office. And I just thought it would be a good opportunity to just take some time and just go over some of the latest advancements in facial contouring. Again, I wish you all well. And with that said, I'd like to go ahead and get started. My plan is to spend the next 90 minutes to really talk to you about my approach and how excited I am to be able to actually make the face look better and truly very natural. That is really, really important. And I want to also just go ahead and show you some of the latest artificial intelligence technology that we have incorporated into the practice that allows us to be able to show you what potentially one can look like with these fillers and Botox, so you have an idea. So with that said, again, I'm so grateful that you're here. I hope you're all doing well. And my plan is over the next 90 minutes to basically go over my approach and what we can do here in the office and sort of make you aware of the artificial intelligence technology that I've incorporated. And the exciting part is to show you a demonstration of a patient undergoing these fillers so you can get an idea what actually is really involved. So with that said, let me go ahead and bring up my PowerPoint. I'm going to share my screen with you. So I'm going to share the screen. Okay, wonderful. Okay, so here we are. I appreciate your patience with this. So the title of the talk is The Latest Advancement in Non-Surgical Facial Contouring. I am also a clinical associate professor of dermatology at NYU Langone Health, where I teach young dermatology residents aspects of surgery, reconstructive surgery. So let me go ahead to the next slide. Great. So again, the outline of the talk is about my approach to the art of aesthetics and how really there's traditional ways of placing the filler. And I want to talk to you about how there's new advancements for fillers and where to place them. There's also advancements in terms of how to inject, where to inject. We're going to be talking about how chin is an overlooked area in terms of injections and how it's important to actually fill in the hollows in the chin area to really create a better contour. I'll finish up with talking to you about non-surgical contouring techniques, and then we'll finish up with showing you a full correction demonstration with the patient. And then we'll end up with this Q&A that by the way, I'd love for you all to please ask your questions. Please enter your questions below. And at the end, with the help of Dana, my assistant, will be able to answer all your questions. This video is also being recorded. This webinar is also being recorded, so we will absolutely share with you a recording of it for those of you who may not be able to stay on for the full 90 minutes. So my approach is about less is more. My approach is about how it is so critical not to overfill the face. A lot of patients come to me and they say to me, I just want to make sure that I'm not going to look like the housewives, person on television. And so I hear that a lot of patients say to me, I want to make sure I'm not rounded. And those are absolutely very, very critical, valid points to address. And my approach is about really creating proper contouring. My goal is about really lifting the jawline, softening the laugh lines, softening the marionette lines. My goal is about to really improve some of the hollows under the eyes. So with that, less is more. It's certainly, there's a proper way of full correction. So there's a proper way of putting the right amount of fillers. And then there is, meanwhile, remembering not to overdo it. By the way, we all know that the traditional method of really rejuvenating the face is really a facelift. And now with the advent of fillers, we can really non-surgically create some really beautiful natural results. So in my practice, I truly feel that really a facelift may be more indicated in someone in their truly like 70s and beyond. But if one starts at the right time, where you're beginning to see some jowling, some laugh lines, you can really improve the face enough that you can postpone the need for a facelift really to much, much later. Typically, this is a picture you see on the left. Someone presents. Majority of the time, I ask patients, well, what really bothers you? And a lot of times they say to me the laugh lines bother them, the jowling bothers them, the hollows under the eyes. And you can see this patient on the right who's had fillers placed on her cheeks, and she's had some fillers placed on her laugh lines, and a bit of filler under the eyes. And it's about really creating natural results. Here's a picture of a before and after. The picture on the left is before, the picture on the right is after. And here's someone who came to me complaining of jowling, sort of heaviness on the lower part of her cheeks. She did not want to go do a facelift. And it's about really assessing the patient in the exam room during a consultation. I usually have patients really look into a mirror. Now we have the artificial intelligence technology that I'll talk to you about. But you can see how in this individual, she's kind of getting hollows in the middle of her cheek. Basically, one of the aging issues is that we lose fatty tissue in our mid-cheek. It's our mid-cheek and lateral cheek that's really holding our face back. And as we lose the fatty tissue, some of it absorbs with aging, some of it moves down and sits here on the jawline. You begin to see heaviness of the laugh lines. You begin to see sort of downward pull on the corners of the mouth. And with just putting a little bit of filler on really on the outer aspect of her cheekbone, you can see how the groove in the middle of her cheek is better. And you can kind of see the contour on the right of her jawline lifted. Really a proper proportion to improving one's face is about really creating what I call a heart-shaped face, where an individual has a narrow chin, sort of a wider cheekbone, so that this way, that's what's created a youthful face. And if you see on the right, she has achieved that. Here's somebody who came in with some crepiness on her cheeks. In this case, you can kind of see on the left, she has some hollowness on her middle of her cheek. And with just some injections on the cheekbone, you can kind of see some tiny needle marks. She has really improved in terms of her lifting her jawline. The crepiness is better. She has just better proportions. So what is the mechanism of aging? And as we age, we really lose fatty tissue. So we really lose fatty tissue in the middle of our cheeks. There's that descent, the downward movement of the fatty tissue. We also lose collagen in our skin. There's that downward pull from the forces of gravity. And as a result, this leads to a loss of structure that causes the face to lose that youthful definition. And the face becomes what we call bottom heavy from the lack of support, mainly on the cheeks. Back when I started doing filler injections over 20 years ago, the traditional filler placement was really just going directly into the areas that patients would notice. In this case, if someone came in with prominent laugh lines, we call nasolabial folds, the smile lines, we would put some filler. A young individual may get away with that, but unfortunately, as we age and from 40s and up, we do lose that fatty tissue from the outer aspect of our cheek that causes these smile lines to become more prominent. So now there's this advanced placement of really addressing the issue with putting fillers into the cheek area. In this case, this individual had fillers just placed in her laugh lines, and you can see really a nice correction. Here's a young individual with this genetic hollowness underneath her eyes that's creating this kind of dark circles, makes her look tired. And in this issue, she's young. We can just address by putting just the right amount of filler into that crease on her cheek. So I basically, in this case, I built up her cheekbones by really injecting not only in the crease of her lower eyelid, but in the cheek area. And we can really create a much more youthful look. The point that I really want to make here is that one of the central aspects of correction, it really has to do with correcting the cheekbone, to really creating a more prominent cheekbone. In this case, you can see the photo on the right, which is after, and her cheekbone is a little bit more prominent, and that just creates a youthful look. One of the other things that is really important to address in consultation is to have the patient look in the mirror and I'm able to point out the areas where there's a deficit in terms of hollowness. And There are individuals where they've actually lost fatty tissue in their temples, their lateral cheeks, their jawline. And then the newest area that I have begun to look even more carefully is the chin area. And when we really contour the chin, we can see some amazing results. And I'll be able to hopefully show that to you later in the demonstration. So it's a misconception that these concerns can only be addressed by surgery, and there are many advances non-surgically to contour the face. I love art. I love aesthetics. I consider myself an artist, and Leonardo da Vinci is one of my really most favorite artists. And I've really studied his Vitruvian method. It's his infamous sort of Vitruvian man that he was able to demonstrate this deep understanding of proportions by blending math and art. So I incorporate that into my injections. I'm able to sort of, I understand scientifically the art of beauty, and I'm able to sort of apply some of these proportions that hopefully I'll be able to talk to you about in the demonstration. And these same rules apply to the world of aesthetics today. And I find that it's my responsibility to be able to inform my patients and assess each person's unique features and angles to really be able to bring that out in real life. And I've really, over the last 23 years as an injector, I've developed this approach of sculpting the face rather than just simply filling the areas that have hollowed. And this Vitruvian method is really, it's just like an architect that creates balanced foundation. I've studied other plastic surgeons, dermatologists who've actually contributed to this field. And it's about really utilizing what we call like MD codes. And these are codes that have been created by a well-known plastic surgeon out of Brazil, and which have even made me a better injector. And what we call CK codes for the cheek, there's C codes for the chin. And it's about really addressing areas that are responsible for suspending our face and our cheek upward. So there are these codes on the cheeks, there are these codes on the chin, and sort of in my mind, I'm able to visualize that and therefore know where to inject. And then lastly, I want to talk to you about the chin. It is an area that not only contributes to jowling, but also contributes to what we call a submental fullness. And there are individuals who come with issues with regards to their sort of fatty tissue below their chin. And when you really are able to assess them and bring it to their attention about how important it is to actually build the chin, to be able to create a beautiful profile, we can actually bring the chin out slightly and therefore create a better angle. And so the chin plays a very essential part in creating a youthful, structured appearance. And the way to determine if chin needs structure is by assessing angles. As I was talking to you about the Vitruvian method, there's a science to where ideally the nose should be placed in relation to the chin. And as you see in the diagram to the left, diagram 1, we see there's a measurement of how far out the chin should protrude. And in reality, the chin should produce, if you draw an imaginary line from the nasal root, from basically the upper aspect of your nose, if you just draw an imaginary line straight down, it should meet perpendicular to the tip of your chin. And a lot of patients have what we call a receding chin. As an example to the left, you can see how this individual, her chin is slightly just a bit hollow. So just by putting a little bit of filler and bringing that chin out, we just create a much sharper jawline. We create a better angle below the neck. And you'll hopefully will be able to see that in the demonstration. Here's a picture of a young man who you can see on the left, he's had some filler placed in his chin. And as a result, he just kind of looks a bit more masculine. He looks, you can see how genetically he just has a somewhat of a receding chin. And by really injecting along the jawline, it's not just chin, that's an area that's injected, but certainly areas below it and to the sides. So again, it's really assessing the angle, making sure that there's a perpendicular imaginary line from the root of the nose down to the chin. Just to show you some quick before and afters, for the sake of time, I want to really go to the demonstration, which I'm excited to you about. Here's an individual on the left. She kind of has this bit of heaviness on her laugh lines. She has a bit of kind of heaviness on her jawline. She really wanted to make sure she looks natural. you may not really be able to see much of a difference, but in this situation, I injected a little bit of filler on her outer aspects of her cheekbone just to create that heart-shaped face. I put a little bit of filler on her lips because that's what she wanted. And she was really pleased with this. And this may not be the most dramatic picture, but I put it in here to show that it's about really less is more. I also put a little bit of filler on her lower eyelids just to improve some of that hollowness. Here's an individual on the left where she came in feeling like heaviness on her lower part of her cheeks. She was bothered by the downward pull in the corners of her mouth. And just by putting a little bit of filler on the outer aspects of her upper cheek, we were able to lift up her cheeks. We were able to improve her jawline and just create a better structure. I want to make a couple of points about moving away from fillers because the title of the talk is about latest advancements in facial contouring. One of the things that we've incorporated into the practice is over the last few months is utilizing this technology, which is called radio frequency. And the technology is called Evoke. It's the latest technology in non-surgical facial contouring. It's actually using bipolar radio frequency, which is just a device that basically attaches to your cheek and your jawline. And in people who have heaviness, we can kind of dissolve some of that fat. So there are instances where fillers may not be the most appropriate option. If someone's really kind of heavy, they have a heaviness under their chin or their jawline, the radio frequency basically heats up the tissue. It usually takes about approximately 5 to 6 sessions. It can be done as early as once a week. And we can actually create what we call fat dissolution. We can really dissolve fat. It's a non-surgical device. I wanted to basically just talk to you about that. Here's an individual, a gentleman who really did not want to go through a facelift. And you have to have fatty tissue there to really cause that tightening. And you can see how he has much better definition in his jawline. He's an individual in his 50s, and he was ecstatic. And you can kind of see just with the use of the Evoke technology on below his chin, on his jawline, plus addition of some fillers. He also had some fillers placed on his cheekbone to really create a better definition. Here's a lady who went through the Evoke technology as well. You can see that this person has just a bit of what we call submental laxity, which is that looseness underneath the chin. And with you can see how there's a better definition. We were able to dissolve some of the fat on the jawline. This individual has had some fillers as well, but you can see the improvement. The results of this will last you for at least 3-4 years. It's hard to stop the aging process. We can also use Botox for contouring. There are individuals where they have kind of basically a square jawline, and especially for a woman, that may create the appearance of a masculine look. So Botox is an innovative way to really achieve non-surgical facial contouring. It helps to slim the jawline. And the reason it works, as we all know, Botox is a muscle relaxer. So when we clench our teeth, we're really exercising this masseter muscle, which then bulges out over time. This can also happen with what we call TMJ disorder, from overuse of the muscles, from excess clenching, grinding of the jaw. And over time, these muscles become larger. They can affect our shape of our face. So Botox is a wonderful way to really slim the facial sort of contour. Botox, as we know, lasts for about 4 months, but it has to be redone again. Here's an individual, is a pretty young lady who has that square kind of shape to her jawline, and just by putting a little bit of Botox, we're able to slim it. And then lastly, there's Kybella. Kybella is an enzyme that's found naturally in our body. It's released from our gallbladder upon eating food. It's what we call a fat emulsifier. It's basically where it dissolves fat. When we ingest fat, our gallbladder releases this enzyme called deoxycholic acid, and it's a substance that dissolves fat. Its science is remarkable. Creatively, a scientist is able to synthesize basically deoxycholic acid and make it available for dissolving fat. So we inject it under the chin to dissolve people who have some fullness. It does take several treatments, anywhere from 2 to 5 treatments. You do get some swelling for about 2 to 3 weeks. It is a non-surgical option. The gold standard for someone who's got fullness is to do neck liposuction, but for someone who doesn't want to go through that, you can do Kybella. Here's examples of what Kybella can do. On the left, you can see an individual with more of an obtuse angle to their neck. And you can see with a series of Kybella injections, you can create a much better angle. Same picture to the right now, a man who has that heaviness on his lower chin, and you have a better angle. So Kybella is another option to evoke. And don't forget, it's important to assess patients to make sure that they don't have a receding chin, because a filler will also be essential to give you the best results. My plan was to have our physician assistant, Haley Brickman, talk to you about our state-of-the-art technology called Chrysalix. But let me just briefly tell you about that. This is really using artificial intelligence. Artificial intelligence has made its way into aesthetics. And what we do now in the practice is we can actually take these three-dimensional images and really be able to show you on a laptop your face on the screen in a three-dimensional way. We can actually rotate the face. It's pretty cool. And we can then, with just use of the button, just kind of somewhat erase someone's laugh line. We can erase someone's brown spots. We can actually add a little bit of volume to the cheeks. We can kind of erase, let's say, someone's fullness. So we can kind of in real time show you what you will look like if those conditions that bothered you were actually erased. Obviously, it's not a guarantee that's the result you're going to get, but we can kind of get real close. And so that's a technology that we've incorporated into the practice. I'm super excited about that because we can actually help patients, show them what they can achieve with just, let's say, lightening some brown spots or just filling in a little bit of hollowness. And our goal is to always create a realistic expectation for patients. That is so critical. So with that said, I just wanted to quickly go over, I'm sorry I kind of sped up because I know that showing you a demonstration can take time. So with that said, I'm going to move over to show you, we're going to go ahead and actually do a full correction on our model to show you how we can approach the different techniques. This is an individual who has actually quite a bit of hollowness in her temples, on the outer aspects of her cheeks. She is somebody who's somewhat hollow in her chin area. So hopefully I'll be able to show you a good difference in there. I appreciate your time. I'm so grateful that you're able to join us. I wish you all well, and I'll certainly, once we're done with the demonstration, we'll come back and then just answer all your questions. Again, feel free to please enter your questions below, and we'll go ahead and answer them. We'll go ahead and switch over to the demonstration. Hi, Adrian.
Hi.
How are you?
Good, thanks.
Thank you for being our model today.
Oh my God, it's a pleasure.
I really appreciate it. I'm looking forward to doing this.
Great.
So we're going to go ahead and get started, okay?
Mm-hmm.
Great.
Great. She's all prepped, her skin is white.
Great. So, Adrian, what I wanted to do was basically kind of just go over what we plan to do today. So with that said, and obviously the audience is watching, so first of all, truly, again, I really appreciate what you're doing. You're really, truly helping us educate people, and I'm so grateful for that. And I know you will get an absolutely beautiful result, but with that said, let's get started, and I wanted to kind of show you what we're going to do today.
Okay.
Okay? So why don't you hold this? Here's a mirror, and I just wanted to kind of highlight a few things. So one of the things that I just wanted to actually mention to our audience. So again, so glad that you're joining us. And Adrienne is our absolutely beautiful patient. She has beautiful features, and she's graciously accepted to help educate people about really what we can do with fillers, which is so exciting. One of the things, as you heard during the webinar, really aging is really as a result of what we call bone loss, which therefore causes loss of support to our fatty tissue and our skin, as well as loss of fatty tissue, redistribution of fat in different locations, as well as really losing collagen in our skin layer. And the goal is to show you how fillers can really address so many of those issues without really resorting to surgery. I just want to highlight some of the issues that I've noticed on her. Ahead of time, I've sort of told her what we're going to do, but I want to sort of point those out to you. If you can see, so by the way, Adrienne has already had a nose job. What we call a rhinoplasty. She has had some Botox elsewhere a few months ago, but her Botox is wearing off. She told me she's had it done about 5 months ago. She's also had some eyelid filler. She's basically had some fillers below her eyelids, which ironically she feels that she doesn't like much because she feels that there's a little bit of swelling. And that's something I wanted to point out to you, that really when it comes to fillers, proper placement and the correct amount is critical. If you really are able to, inject fillers in just the right amount, in the right location, you can create beautiful results. So it's not really about the fact that it's a question of how much really we need to put in. We don't want to overdo filler placements, and it's all about making sure that she looks natural. Bear with me with the mask on. I wish I didn't have to wear this mask, but because of the mask, I may have to catch my breath here and there. So just bear with me with that. So as you look at her, one of the first things that's striking about Adrienne, she has beautiful eyes, but she also has really nice cheekbones. But one of the things that, why don't you tell me what bothers you actually? Why don't you tell me, you had told me what bothers you.
The hollowness that I have on my temples.
Okay.
Then the marionette lines a bit, and also like the little bit of kind of droopy jowling I have here.
Beautiful. Okay. So, and I appreciate that. And it's remarkable that generally that is one of the common complaints we get. Patients come in here complaining that they're beginning to see their laugh lines. But when you actually evaluate patients, it's important to really educate the individual, to really let them know what the cause of those laugh lines are. Back maybe 10, 15 years ago, the issue would be that we would just kind of fill these lines. But eventually people would sort of can create like a full area, which is not feminine. The real cause of these laugh lines is from loss of collagen, loss of fatty tissue here. So what I was trying to explain to you, Adrienne, is that really our cheekbones act as support. And when we lose fatty tissue over time, as a result, the skin just kind of sags and pulls down. So it's important to actually, the underlying cause of these laugh lines is loss of fatty tissue and support. So the fact that our bone resorbs, the fact that the fatty tissue is lost and it sort of moves down and sits here. It's the fact that we lose collagen. So by injecting some fillers here, you will see how your cheek will lift up and therefore your laugh line improves. You will also see by injecting here how we can actually elevate the jawline and how you will see your jawline will actually lift up. What's actually really important in your situation, which we don't necessarily see all the time, is you have unfortunately a lot of hollowing in your temples. And even the temples really play an important part in supporting our cheekbone and supporting our jawline. So once I inject this temple, not only proportionally you will look even better, but you will see how your jawline will elevate. So what we're going to be doing today is really injecting her temples. We'll start with that, because to me, I think that is really plays a big role in her jawline sagging. Then we're gonna basically fill her cheekbone. She also has a bit of hollowness in her mid-cheek, we call it, so we're gonna fill that. And then if necessary, we'll fill your laugh line, which I don't think you will need. One of the other things that I wanted to point out which is really important, is in evaluating you, you actually have what we call this submental fullness. You have a little bit of sagging underneath your chin. So in a profile, not only you have this sagging jawline, but you have a little bit of fullness here. So, and that is to me contributed as a result of aging. Obviously our neck muscles sag, but you also have a receding chin. And the way to know that is, again, there's an art and there's a science to beauty. And one of the scientific principles of really beauty is to make sure that your chin is proportional. And one of the things I wanted to point out, I hope you can see this in the video, is when you actually, and this goes back to actually Da Vinci, and when you draw a line from the root of your nose down below, when you draw a straight line, her chin, let me just please make sure I do that. So her chin should be really more projected forward. So she has this recession here. You can kind of see how she has a little dimple here, but in addition, just her bone is resorbed. So we're going to actually fill that area. And by filling this, we can create a better proportion for her chin profile. And you will see how this sagging will actually improve. When you protrude the chin slightly, you will see an improvement here. So we're going to do that as well. So I'm really excited.
Yeah.
One of the things that I also wanted to really pass along is that by using needles, you can cause a lot of bruising. My patients come here, they're all active, they're all working, they're all social. And one of the things they have said to me is, I want to make sure I don't get bruised because maybe they've had experiences elsewhere where they've had bruising. So I like to use cannulas. Cannulas are blunt instruments. They're shaped like a needle, they're extremely thin. You'll see me use them. But they really minimize the risk of bruising because they're absolutely dull. So with the cannula, we can actually insert this cannula below your skin. I have this flexibility of maneuvering it and moving it. And with that, we can really create a beautiful result with really minimal issues with needle marks. And you can really walk out of here, put a little bit of makeup and be presentable and go out for lunch if you wanted to. So let's get started, okay?
Great.
Yeah. So, you're filming? Okay. So one of the important things that I'm proud to say we follow is we do this under sterile technique. To me, it's absolutely imperative that we do this in a manner where patient safety is foremost. So we want to avoid any issues with any complications. We use sterile gloves. We've actually already cleaned her face very carefully. You'll see my assistant, Kat, who's also following a sterile technique. So one of the things we're going to do is kind of just mark her in terms of where we're going to focus on. So one of the things you can kind of see, I hope you can see this, she has kind of this hollowness in her temples. So we're going to be filling that. You can kind of see this is area that I'll be injecting. We're going to be going and just kind of injecting her cheekbone slightly to just enhance that a little bit more. One of the things you can actually see is how she's kind of really hollow in her what we call the mid-cheek area. I'm going to sort of I do this just for really showing it to you. When I'm actually treating a patient, I will not draw these lines. But I do that for the purpose of showing you that there are scientific principles where if you draw a line from what we call the tragus, which is this cartilage in front of your ear down to the corner of your nostril, as well as a line that goes from the corner of your eye down to the corner of the mouth, we want to basically focus on this outer box here. She does have a little bit of hollowness here, so you'll see me inject here. You can kind of see this puffiness from a filler that she's placed elsewhere, which she's not happy about. So I'm going to, by putting a little bit of filler, be able to hide that even better. And then the other things that we're going to be really focusing on is you can kind of see how she has this kind of hollowness on the outer portion of her chin. We're going to go ahead and kind of inject her mid-chin. There are scientific principles of really proper placement. You'll see me do that. With that said, we're going to go ahead and get started.
Yeah.
Okay. Are you comfortable? Just want to lean her back a little bit. That's good.
I'm gonna close my eyes.
Yes. Do you want us to bring your feet up? Are you good? You bring her feet up a little bit. That's perfect. Thank you, Kat. That's good. That's good.
Thank you.
All right, excellent. So the first thing to do is it's okay. One of the first things to do is to start out by injecting her temples. For this portion, I will use a needle. It's about really proper placement. We want to inject these fillers deep. So here we go. You're going to feel a little pinch, okay?
Deep breath. Good job, Adrian.
I'm just kind of injecting very slowly. There is a numbing agent in this filler, so in about a minute or so, Adrian, you are going to feel a little bit numb.
Good job, Adrian.
Good job. Beautiful.
Okay.
Love your smile. Thank you for... Here we go, okay? Just injecting a little bit at a time. So that was one syringe. So we went ahead. Actually, one of the things I want to talk to you about is, which I forgot to mention, is my favorite fillers. This is really important because not all fillers are created equal. I use this technology, which is basically called Vycross technology. It's basically, the brand name is Voluma from Allergan, the makers of Botox. And I love that filler. The reason I love that filler is because it is pretty much, in lay terms, a concentrated hyaluronic acid filler. It is viscous. It is cross-linked. We don't see reactions. By the way, the product that we use, as you know, is hyaluronic acid, which is a complex sugar naturally found in our body, in our collagen layer. So Voluma is really a nice thick filler that really holds well. It sits there. It has really, the duration of it can last up to 2 years when it's injected properly. And I don't see reactions to it. And I love using it. And it's just a very, very natural filler. So what I just did was inject Voluma into her temple. You're going to see some needle marks, but I don't know if you can appreciate this. That was just really one syringe. But I hope you can see how her jawline is actually better. Her jawline is actually lifted compared to the left side just by filling her temple. And that was just with one syringe. One of the important concepts that I always try to tell patients is that we want to really correct them properly. We want to do what we call a full correction. We don't want to be under-correcting where they're not really excited because they're not going to see a result. So there's a balance in terms of making sure you fill them properly, but not overfilling them so that they don't get too full and hence that they don't look natural. A lot of my patients say, please don't make me look like that person down Madison Avenue who just looks really fake. So that's something I hear every day. And so it requires a tremendous amount of hand-holding to say that I promise you I will not do that. I myself don't believe in that aesthetic. I believe that patients should look beautiful and natural, where nobody knows that they've had fillers, yet they just look amazing. And they say, what did you do? So I just basically, can I show this to you? Because I want you to be involved with this too, so you get excited. This was just really one syringe. Look at your temple. Mm-hmm. If you notice, compared to the other side, it's not as hollow. Mm-hmm. I mean, you are going to see some needle marks, but we're going to kind of just stop there. I would probably inject another filler maybe in a month from now, like another syringe of that same filler. But we're going to kind of just go. But what I wanted to actually point out to you is, do you see the improvement in your jawline?
Yes.
Do you see how this jawline is a little bit higher compared to here? Mm-hmm. Do you see that? Okay, so that to me, I get really excited. Okay, so So now we're gonna, my goal is to really finish one side before we go to the other side, because that's where you can really see the comparison. So now we're gonna basically inject your, what we call the zygomatic bone. The zygomatic bone is a bone that goes right over, it's the cheekbone. So you have already beautiful cheeks. I don't want to make them even more, they're already beautiful, but we do need to just put a little bit in there. So here we go, and they're really three, and again, we follow a sterile technique. You're going to feel a little pinch, okay? I basically injected about what we call 4/10 of a cc. So I basically put in about 0.1 to 0.2 cc's in 3 different points. And I just do a little bit of massage. We're generally listening to music in the room, we're generally talking to patients, but for the purpose of this education, where obviously those things are quiet. How was that, Adrian?
It was fine.
Okay, beautiful. So here's where we're going to go ahead and switch over to the cannula. This is where we're going to inject what we call the mid-cheek. And here I like to use a cannula because I really don't want you to get any bruising. So now here we're going to go ahead and do the cannula portion. Again, cannula is an instrument that's shaped like a needle. It's dull. It allows me to basically inject the filler in a variety of places. As I mentioned to you, there is a numbing agent in the filler, lidocaine, which really helps numb the area. Again, we're following the sterile technique. So you're going to feel a little pinch, okay? So we basically use a tiny little, what's called an introducer. Introducer is like a little tiny needle. So go ahead, Kat, and Kat's going to remove that. For this part, you can just bring the light over here for me. Okay, thank you. Okay, so here, the cannula is kind of inserted. Now, Adrian, you may feel a little push and
A little pressure.
just a little bit of pressure. And I'm just basically advancing the cannula in different directions. And just as I'm doing this, I'm just putting small aliquots of voluma in different positions. How does it feel to you?
It's okay. Not a big deal.
Beautiful.
Just give me another one with the cannula. Is that okay?
Mm-hmm.
I love your results. You will see it for yourself in a minute. Already your jawline is tremendously changed. This is the part I get excited when we do almost like a timeout where we show one side versus the side that's untreated. But you were hollow in your mid-cheek. And sometimes people do that just even if they lose like a pound or two.
It goes straight from the face.
It just can come out off the face. And the key is to, you know, do what's called adequate correction. Sorry about that.
That's okay.
So I put in, if you remember, there was about a half a syringe from the other syringe, and now I put another half here right now. So each person is different, and this is where the art of injection comes in. We don't follow a cookbook approach. It's really about making sure that you put the proper amount to fill the patient and yet not overfilling them. So each person's different. And that is the beauty of what I do. This is why I love what I do, because it allows me to be an artist. It allows me to really look at a patient, see what they need. I'm going to put a little bit more. I still think you're a little bit hollow in here. And again, each person's different. So in Adrian's case, she needed her temples done. It's not that common for me to do temples, but yet I do them. In her case, her cheekbones were beautiful. Ironically, majority of people need fillers in their cheekbone. In her case, her mid-cheek was kind of hollow. So I consider her issues to be truly different than majority of people who I treat. Majority of people I treat, they actually need their cheekbones, which is the major cause of jowling. In her case, her cheekbones were pretty good. I didn't need to do much there. So if you notice, can we just get an alcohol and wipe this?
Sure.
So, and again, it's so important that when we inject these fillers, we are aspirating ahead of time. So as soon as the cannula goes in, we do pull back on the syringe to make sure we're in the right place. Correct. We're not, we're not in a blood vessel, because that is a major issue. So we are very careful. I just want you to be able to compare her jawline and her cheekbones and temple and compare it to the other side. If you can just, and if we can set her up maybe a little bit so she can see it too. That's good. Here, I want you to see and tell me what you think.
Wow. Looks great.
Remember that heaviness you had here? Mm-hmm. And look and compare it to the other side. Do you see how it looks like you got almost like a mini lift? Mm-hmm. So your temples are properly positioned. They're not hollow like this side. You have really nice cheekbones. Do you remember that hollowness that you had here? Look, it's filled in, and you have like a model look. You already look beautiful, but how the hollowness is gone. Your jawline is sharp compared to here, which is kind of sagging. Now, we haven't even addressed your chin yet, but what I want to do is really now duplicate what I did on this side here, and then we'll focus on your chin, because you'll see how your chin will even make that better and will improve your angle here. But I already love the results. And one of the things I'm really happy with, you barely see needle marks.
Right.
You're going to see just a couple of needle marks. This is the beauty of using cannulas. You can kind of see, I didn't have to go with multiple pinprick injections. She can literally put a little bit of makeup and go here. If anything, she has like a tiny little bit of, unfortunately, a little bit of bruise, and that's where I use the needle. And this is the point about how we want to minimize that. But it looks amazing. We're going to go ahead to the other side. Okay, so again, we're going to light over that trace. Thank you so much. You're able to hopefully all see how her jawline is tremendously improved. We're going to start with her temple here. You can kind of see the hollowness here. This is where, unfortunately, I do use a needle. I can use absolutely a cannula here. I can do that, but I'm comfortable just using a needle here. So you're going to feel a little pinch. I'm always aspirating as I inject. And I'm just going. How are you doing?
Good.
Great patient, Adrian.
Okay, all right, so that was one syringe that I used on her temple. And you can see how the hollowness is significantly better. From my experience, she can use a little bit more, but for the purpose of just finishing everything, we're going to hold back here. We're always holding a little bit of pressure. How was that pain on a scale of 1 to 10? Like 10 being the worst pain?
Like a 3.
Okay.
It was no big deal.
Okay.
Do you feel the numbing happening on the other side?
Yeah.
Yeah.
All right.
It's
And I
all
appreciate your
really
candor, your honesty. I want people who are watching this to be able to really get a feel for what do these needles feel like. These are tiny, what we call 30 gauge needles. I'm sorry, this is 27 gauge needle actually for the purpose of injecting Voluma. So they're tiny, and it's all about injecting slowly. All right, so now the next step is just kind of adding a little bit of volume to her cheekbone. Again, we're using the filler, which is called Voluma. It is what we call Vicross technology. It's 20 milligrams per cc. It's basically a cross-linked hyaluronic acid filler that really can last up to 2 years. And one of the things we do is patients come in, we take their photos. When they come back 2 years later, we're always going back to their old pictures, and yet there's still a difference. And I think that's because these fillers really stimulate your own collagen. They can actually, studies have shown when you place these fillers next to the bone, you can actually stimulate bone. So they have really revolutionized the treatment of, basically aging by avoiding the need for surgery early on and really being able to make people look better. All right, so here we go. Just aspirating as we inject. I know the anatomy of the face, so I'm happy that I know where I'm injecting. I'm going to kind of go in her temple a little bit, just put a little bit in here because she's a little bit hollow in here. Okay, and that was, like I said, a syringe in her temple. It was about 0.7 syringes, 0.7 cc's of the syringe in her cheekbone. I did put actually a little bit back in her temple. So now we're going to go ahead and switch over and treat her mid-cheek with a cannula. Meanwhile, I'm just kind of holding a little bit of pressure. Before we even do your mid-cheek, I want to show you how it's already improving without even doing your mid-cheek. Do you see how your jawline got better? Mm-hmm. You see how that sagging is better? And again, just so your temple is better, you have a little bit fuller cheekbone. Now we're going to address this location here. This is where you're kind of hollow.
I can really see the difference from this side to this side.
Right.
Good. Looking beautiful, okay?
Thank you.
So I basically touched the mirror. Let me just change my gloves for a second. That's about... we're going to go ahead and address her mid-cheek. And we're going to, again, using Voluma so far. All we have used so far is Voluma. One of the things I wanted to mention to you is, just to put things in perspective, is that each syringe of a filler is 1/5 of 1 teaspoon. So remember that, 1/5 of 1 teaspoon. And if you just remember just what I did on her left side, I did 1 syringe here. I did pretty much about half a syringe here. And then we did about, I think, a syringe and a half. Mm-hmm. So 1.5 from 1.5 is about 3 syringes. So that was 3 syringes on this side, and that is still not equal to 1 teaspoon. It's about 3/5 of 1 teaspoon. So I don't want you to think that even though we're using multiple syringes that there's a lot going in. It's really important to understand that. So we're going to go ahead and okay. So you're going to feel a little pinch. Again, my goal is to really fill in this hollow here. We can go from different angles. In your case, it's better to just kind of start out here. This is what we call the introducer. So you're going to feel a little pinch. This is the really needle that allows me to create. Kat's going to pull that out. Okay, and we're in. Okay. How was that?
Fine.
Okay. All right, so we're really in the right plane. This is what we call the subcutaneous plane. And this is really about just kind of going in different directions and just filling in that hollowness. You're doing so well. I love using cannulas because it minimizes the number of pinpricks we would have to make if we were using a needle here. And this is all done through one entry point.
Good job.
And that was 1 syringe. Let me see. I love your results. So we're going to just make sure, and again, one of the other things that it's important is that no one's ever symmetrical. And that's why we don't follow a cookbook approach. It's not necessary to put the same exact amount. You really look at a patient and you see whether they need another syringe. In her case, I love to put a little bit more in, but we always find the side that people sleep on tends to need more filler just because the effects of compression from laying on that side regularly, there's like loss of fatty tissue. So it's about, again, it's an art. It's an art of injecting, knowing where to put it, how much to put it, not over treating, but yet treating properly, treating to our end point. And I'm right underneath her skin. I'm not really going into any structures. All the important structures are further down. All right, and that was it. So that was 1.5 syringes. And that's what it took for her. But we're going to wipe this and show you. And meanwhile, I am just kind of massaging.
Beautiful. Margaret.
Yeah. So let's wipe the channel.
Yeah.
And I want to. So the only thing that's left now is her chin.
Beautiful.
So if you notice, if I can just please position your head, is she has a beautiful jawline. Her temples are corrected. She has nice cheekbones. Everything is proportional. One of the things I hear also patients say, I don't want to look rounded. And our goal is not to make anybody look like the Pillsbury Doughboy. So it's really, she has beautiful cheekbones. Her hollowness is gone. Her jawline is lifted. And you can see how on this side, she has, her temples are fuller, her cheekbone is nicely accentuated, and that hollowness is improved. I'm actually going to put a little bit more in here, and then I will show you. Yeah. So remember that it took 1.5 cc's to fill her mid-cheek, and I've already put 1.5, but she kind of needs a little bit more because I see this hollowness still. So I'm going to go back in. And I basically just put in that extra half a syringe. So that took about 2 syringes, but it made such a beautiful difference.
Yeah.
So, Adrian, take a look. But I want to show you because I'm excited, and then we want to show our audience too.
Wow. Oh my God.
Can I fix this?
Sure.
Yeah. Great. So, a couple of things. Look at your temples. They're not sunken in. Look, you still have your beautiful cheekbone. It's not overdone, but yet you have nice features. And look at that hollowness. And look what it did to your jawline. And yet it's all, you can really not, you can barely make out the entry points of this.
So good. Oh my God.
I actually see a difference in your neck,
mental, right?
yeah, below your chin, because you had this little heaviness here, and yet this is better, and we're going to see that get better. So if you notice, like, she didn't have much of a laugh line, so that's not an issue, but now we're going to correct her side profile where, I mean, again, she's a beautiful woman. On the frontal view, you may not see her receding chin, yet on an angle, I hope you can capture this. She has this recession here, we call. So we're going to go ahead and just inject that. These what we call marionette lines, these creases. I find these creases sometimes are just from sleeping on your side where the skin folds. So it's, you know, it's not easy to sleep on your back. So she has like a little bit of marionette line, a little bit of creases here. She has a little bit of crease below her lip. She has the same line, kind of this marionette line here. Generally, patients who come in for what we call these, nasolabial folds or parentheses, we can inject these as well if once we're done with the voluma. For the purpose of just this session, we're really just addressing her chin, but we can also address the lip with other fillers like Volbella, which is a more thinner filler, which really has longevity of about 6 months to a year, depending on how much you use your mouth. We're not going to inject her lips. We can do that in another session. Again, we could have injected her laugh lines if that was still obvious. In her case, she doesn't need it. So it's all about really doing what's necessary. So let's get started. So we're going to just start out by putting a little bit of filler in her mid-chin. If you notice, she has like a little bit of hollowness, like right here. So we're going to kind of correct that. I don't know if she has a scar there. Do you have a scar there? Okay, so that's why. So she has a little indentation. We're going to put a little bit of filler. So you can feel a little bit of pinch here. This is just going right below her skin. And it just immediately corrected that.
Beautiful.
So you can kind of see that hollowness. She has a little bit of hollowness here, so we're going to kind of just do that. Then we go back to her scar and just kind of fill that scar. So already her chin is just better. So now we're going to switch over to the cannula and just go ahead and do that. Okay. And my goal is to just kind of bring out her chin a little bit, a little pinch. I like to enter from here. Okay, so we're in. How are you doing?
Good.
The nice thing about the cannula, don't forget, is no needles. And it's about just really kind of putting in the right amount. What I'm excited about is now there is approval for chin area. So there's this recent indication. By the way, the voluma that I injected into the temples is really off-label, but I've been doing it for years. But now there's FDA clearance for use of voluma in the chin. So that's going to really revolutionize addressing the proper profile of patients. So that was one syringe. Now, you can, I don't know if you can appreciate how one side here is actually fuller than this hollowness here. I hope you can all see that. And again, sometimes people need multiple syringes. We kind of inject as we go and see what it takes. So, I don't want to make this too scientific, but the chin is really divided into different subunits. There's the mid-chin, there's the actual, what we call the lateral chin, and then there's what we call the prejowl sulcus, which is kind of this area here. Now, some people are really hollow here, where they kind of, because they've lost the support, they have like a pouch here. So in her case, she doesn't. She looks great. But it's about really making sure that we're not just injecting this into the chin to create a bulbous chin. It's about really feathering it. It's really about defining it. It's about really going into each and every subunit. I really addressed her chin, her lateral chin, but we want to kind of go into what we call this, the prejowl sulcus. And I'm going to use that same entry point. And my goal is to really kind of define her chin. I am incredibly mindful of not putting too much. We want to make sure we maintain her chin in a feminine way. For men, there's a more masculine way, so there's a different way of injecting it. So that was 1.5 syringes. We're going to, I hope you can all see the difference in her filling. Why don't we show Adrienne this too? So she gets all excited about it. But do you see how this area is filled in and yet she's really hollow?
Take a look.
Yay.
What do you see? What do you see? I'm curious to hear your
Look
point
at
on
that.
this.
Look at that.
I see way less lines on this side as opposed to like this side. I see like
Look how
smooth,
your jowl
Yes.
is gone.
the lift.
Yeah,
It's
so you have this
completely gone.
amazing, beautiful jawline extension coming down to here. So we're gonna go ahead and do this side now. Again, we're gonna use the cannula. So this took about 1.5 syringes. Little pinch here. Again, this is the introducer needle. Okay, we're in. Okay. If you need a break at any point, let me know. So again, we apply, a customized approach to each and every patient depending on where their needs are. And I'm just right below the skin. I'm not deep at all. It was 1/2 syringe. Very important to just, follow a sterile injection technique. She's a little bit hollow in the corners of her lips. I'm just putting little drops. And it's about really injecting slowly. And then again, addressing what we call the pre-jowl sulcus. And then just kind of making sure we bring the chin out a little bit. Love your results. You're going to see the incredible defined. Now she's quite hollow in her chin area. Now some people don't have that hollowness and they may have a fine line, so we can resort to hyaluronic acid fillers that are less viscous. Whether it's, we can use a velour or other products. So in her case, she was really hollow, so we addressed the foundation. It's about really going properly building it from bottom up. If she still has some fine lines, we can use a different filler to really address those really fine lines. For the purpose of keeping our discussion sort of basic, I'm not really resorting to too much of science, but for those of you interested, I'm happy to talk to you. So, which side do you sleep on? Just curious. Do you know what side you sleep on?
My left side.
Okay. So, 1.5 syringes on either side. So that's a total of 3 syringes so far for her chin. And I find just from looking at her, she can use more because she's still kind of a little bit hollowed over here. But there is a massive change in her just jawline. We're going to set her up a little bit and show her. So now that we're done with fillers, I just wanted to kind of show you what we have done here. As you can see how she looks even better. Her temples are filled in. She could use more here, but just for the purpose of just really addressing the major areas, I stopped at 1 syringe on each side. You can see how she has really beautiful cheekbones. One of the major things that I noticed on her is this kind of mid-cheek hollowing. So we addressed that with fillers. And then you can kind of see how we addressed her chin and the fact that she had this receding chin. And we basically made it very proportional by putting fillers here. And So again, one syringe on each side. It took roughly about 3 syringes on each side here. And then we did, I think, a total of, I think 4 syringes here. What I'm happy about is the temples are improved. Her cheekbones are better, mid-cheek is better, her jawline is lifted, and she has a nice contour, her chin is properly placed. And you can kind of see how this angle below her chin is actually became much better. It is now more horizontal as opposed to sagging. She looks great. These lines are so much better. Go ahead and smile. You can see she looks great smiling. One of the things that we did not address, which I will do, like, I'm going to ask her to come back in 3 weeks, Adrian. And what I love to do is we can address it, and I'm putting more in here for you. I would love to do your lips to create balance. It's about really fitting the proper picture. I would love to even kind of help her with her eyebrows, but we can even do a little bit of filler in here. She's had an upper blepharoplasty elsewhere a couple of months ago. The other thing that I just wanted to show you is how her angle is really better. And as I was mentioning to you, that if you basically draw an imaginary line from the root of the nose down to kind of the chin, there should be really a line where the points kind of meet. So here, and if you remember, like her chin line was really receding, and now at a much better angle, there's if I can just kind of show this to you. So her chin now kind of gets really close to that Q-tip stick. Before, there was a much wider gap. So her chin is protruding forward, and yet she still looks great. I think, again, we'll do her lips in a few weeks. One of the things that I did not address, which got better, was she had this mid-cheek hollowing. As she had mentioned, she had some fillers on her lower eyelids. She wasn't that crazy about, but just by putting these fillers here, her actual lower eyelids got so much better because we created support for her lower eyelids. And she looks really good. So that's a wrap, really. That's basically it. Hi. So I hope you enjoyed that. I hope I know it was a bit long. I realized it was actually going longer than I expected, but I appreciate those of you who stayed on. And I hope you were able to actually see the difference in terms of the improvement in her temples and her cheekbones, and certainly the hollows and the outer aspects of her cheek and jawline. For the purpose of time, I want to just quickly go over the Q&A. We are recording this, so we will be sending this out to you if you're interested to rewatch it. We certainly value your opinion. I would love to get feedback. I think would love to send you a survey about how we can improve our webinar. Our goal is to have, hopefully, webinars either monthly or every other month, and sort of incorporate this in the middle of the day. Let me go ahead and just bring up the Q&As, and then I'll answer all your questions, and we'll finish. So let me just start on top. So we were going to send you the recording. So one of the questions was, how long do these treatments last? It really depends on the type of filler that is used. First of all, let's start with Botox. Botox generally lasts for about 4 to 5 months. Some people can metabolize it slower. Some people can metabolize it longer, but it will really last you about 4 months. I am proud to know where to inject. I do a lot of skin cancer surgery, so I know the anatomy of the face quite well. I know where the nerves and the arteries and certainly the muscles are. So it's about really proper placement as well as the proper concentration. So generally, Botox will last you about 4 to 5 months. And the common areas with the Botox are between the eyebrows, the forehead, the crow's feet. We can inject it under the eyes to soften some of these lines. We can inject it, as I said, in the masseter to slim the face, and we can inject it into the neck to get rid of these bands. With regards to fillers, Voluma, which is the most viscous, the most thickest filler, the most thick filler, it will generally last you about 1.5 to 2 years. It has, through scientific research, been shown to last up to 2 years. I've had some patients who show up after 2 years, and when we look at their baseline photos, they still look better. So I have seen numerous times where it's lasted more than 2 years. It's all about proper correction. I want to really highlight that to you about how it is important to correct someone properly so that they do see that difference, so that they can actually see the results last up to 2 years. If we really undertreat someone, they're not going to be impressed, they're not going to be excited. But at the same time, we're not going to overfill. But fillers, generally, Voluma will last up to 2 years. Fillers around the mouth can last you about 6 to 9 months. But fillers generally last about a year and a half. So I hope that answers that question. And the other question here says, if you came in for a consult, would you tell a person that it would be better for them if they had a facelift? I would absolutely do that. It would not serve the person well if I didn't tell them what they really needed. And my goal is here to establish trust, confidence. It is critical for me that patients know that I'm genuine, authentic, and I care about what their well-being. And so if somebody needed a facelift, I've said that numerous times to patients that, hey, I think you would benefit from a facelift. So, but I would also let them know if I felt that there are alternatives. There are skin tightening devices, for example, that we didn't talk about here, like Ultherapy, other radio frequency devices. And I would also say, hey, you can get a phenomenal result with a facelift, but if you're really not someone who wants to go through a facelift, we can improve your skin and give you not the same results as a facelift, but somewhat of a nice improvement. The other question was, what can be done for the neck? So it depends on what person presents. Generally, some people sort of have some fullness, and that can be either treated with neck liposuction. It can be treated with Evoke, as I showed you, in terms of dissolving the fat through heating it up with radio frequency. We can do Kybella. If someone has crepiness on the neck, one can do laser resurfacing in terms of tightening it, in terms of smoothing it out. If someone has what we call kind of discoloration, like from sun damage, you have brown spots and red spots, a condition we call poikiloderma, we can do lasers to just get rid of the brown, red discoloration. So it's really based on the presentation. There are times we can actually put fillers. If someone has these horizontal neck bands, we can absolutely just put some fillers in these horizontal neck bands. So there's a variety of different options based on what the patients present with. Botox for what we call these vertical neck bands, fillers for horizontal neck bands, lasers for discoloration. We can do what we call a carbon dioxide laser resurfacing for crepiness. And then we can do skin tightening. And that skin tightening could be either through Ultherapy, which is an ultrasound device, or someone may just need a facelift. They have a tremendous amount of laxity. Moving on, one of the questions was, do you no longer use Sculptra for hollow temples, only Voluma? So let me talk to you about what Sculptra is. So Sculptra is basically what we call poly-L-lactic acid. It is basically a molecule that is similar to a complex sugar molecule. It is really ground up like suture material that we use for someone who's super hollow. Sculptra is a phenomenal filler. I use primarily now Sculptra for someone who is super, super hollow, like someone who's a lot older. I may use it, for example, on sort of hollows from someone who wants to, let's say, enhance their buttock, for someone who has indentations from liposuction. I'll use it, as I said, for someone who's severely hollow. I won't really use it on temples. I have used it. I like Voluma because Voluma, with one treatment with proper filling, we can get it to last for 2 years. Sculptra requires multiple visits. Sculptra requires really, truly about 3 visits to get a phenomenal result. If I find that individual can be addressed with just Voluma, I'll do that. If I find it's going to require too many syringes of Voluma, then I'll explain to them about the use of Sculptra. We talked about how long the fillers last. And then there's a question about cost. And the cost of these syringes it's important to understand that they range depending on what the filler is, what the typical filler is. And those syringes really, I hope I can say it here. I hope it's really, the fees can range from $850 to $1,200 a syringe. But as people do more syringes, there is actually an adjustment made on the cost so that to make it reasonable. The thing that I would ask that patients take into account, and this is one of the issues that I think I unfortunately see happen when patients come in here where they've gone elsewhere and they've sort of made their decision based on cost, because now you get a variety of different licensed health professionals, which are not necessarily just physicians, who may be doing this procedure. You kind of unfortunately get what you pay for, because you're maybe dealing with someone who doesn't quite have the understanding of the anatomy of the face. They may not have the experience. They may follow what we call a cookbook approach and do the same thing for everybody. They may not be using cannulas. And there are issues with these fillers. These fillers can potentially have issues. There's the major complication of what we call vascular occlusion, where unfortunately the filler can get into a blood vessel and block the flow of blood. And certainly my goal is not to instill fear, but I want to basically tell you the facts. So I would say, if my sister, my mom were going to get a filler and I wasn't around to do it, I would say, please make sure you seek someone who's really experienced. And cheap can be expensive. So it's really important about, the technique that's used, the amount of filler that's being put in, what kind of filler, how is it being done, what's the expertise of the individual. Another question is, at what point do you recommend surgery instead of fillers? So with Adrian's situation, you saw she's not a facelift candidate. She's not a neck lift candidate. She actually had sort of nice structure to her face. She had beautiful cheekbones, but she was really hollow. She was hollow in her temples. She was kind of hollow in her cheeks. So in her situation, surgery would not address those. So surgery is really generally in someone who's in their 70s, 60s, 70s, has tremendous amount of loose skin, and therefore they just kind of need to tighten that. Ironically, I see a lot of patients who have had a facelift and come in for fillers. I see numerous patients who have had a facelift, let's say 10 years ago, 15 years ago, 6, 7 years ago, where over time, unfortunately, with just the inflammation, the healing, the basically lifting the skin and pushing it back, and in terms of just the fibrosis or scarring that can happen under the skin, people do generally post facelift at some point do get hollowing. You can't stop the aging process. So, with over time, the skin may be pulled back and tightened back, but people begin to see hollows, and the hollows can happen in, weird places. So a big part of my practice is actually patients post facelift. And I'm not talking about like 6 months, 3 months. I do see those patients, even with a facelift, you still have some, what we call the laugh lines that are not addressed, the marionette lines that are not addressed with a facelift. Facelift is about really just improving your jawline. So I've seen patients immediately post facelift, and I've seen patients 10 years, 15 years out where they're getting hollowing. What is the cost for EBBVU1 treatment? I think maybe that the question is, what's the cost of Evoke 1 treatment? So Evoke, I assume that's what you meant, but the cost for Evoke is usually you need truly about 4 to 6 treatments. And the cost of the treatment for 1 treatment is $1,000, depending on how many areas you do. Again, there's these sort of, we basically put the fee together for about 4 to 6 treatments to make it extremely reasonable for patients. Our goal is for my intention every morning I walk in here is to make sure our patients are happy. What do I think about Morpheus 8? So Morpheus 8 is a great treatment. Morpheus 8 is basically a technology that utilizes microneedling and radiofrequency. So it's a great treatment for acne scars. It is a good treatment for a little bit of like dilated pores. It is a great treatment for maybe a little bit of crepiness. Basically, it's basically delivering about 20 needles into your skin, and along those needle pricks, there is heat delivered, radio frequency delivered. So not only the action of a needle under your skin stimulates collagen, but that heat that gets delivered. I'm a fan of microneedling. We utilize a different technology in my practice that is basically from just another company. It's called ND-Med. It's exactly like Morpheus 8, but I primarily use it for acne scars. And even with acne scars, honestly, there's better treatments like Fraxel. I use my microneedling device for someone of skin of color where you can't use lasers. So that's where Morpheus 8 or other microneedling technologies come into play. We have a large population skin of color. There's a variety of ethnicities in New York City. So we see our beautiful patients who are dark skinned, and that's where I may use something like Morpheus 8. What do I do for brown spots on the face? So brown spots on the face, which are primarily from sun damage, it depends on the skin type of the patient. Patients who are fair-skinned, blonde hair, blue-eyed, I'll use Fraxel if they have diffuse pigmentation issues. If they have 1 or 2 spots, I'll use what's called a picoway laser. These are amazing state-of-the-art technologies. They work quite well. They can require 2 to 3 treatments. Unfortunately, there's no lightening agent by itself at home that can really get rid of brown spots. And then we have a large population of Asians, Mediterraneans, dark-skinned people who have discolorations, whether it's brown spots from sun exposure or from just discoloration from a scar. And in those individuals, we have to be super careful. We have a picoway laser, which is an extremely gentle laser that doesn't influence one's skin color. So again, depends on the color of the patient and how many lesions they present with. Another question is, does it ever make sense to remove buccal fat pads from the face? So buccal fat pads are, it's basically an area of fat pad right in the middle of our cheeks. It basically, there's a trend of young people removing their buccal fat pad to create what we call like a top model look, to create like hollowness here. I am not a huge fan. Again, everything I tell you, it's a generalization. It varies from patient to patient. If someone really has the rounded face and they want to create a definition, you could remove that buccal fat pad. But the problem with removing that buccal fat pad is that you may, for the first few years, love the results because you have a little hollowness here. But don't forget the aging process. The aging process over time makes us hollow here. So there are instances where, you will see, unfortunately, 10, 15 years out, you're going to get severe hollowing. That buccal fat pad serves a purpose. It is basically supporting your cheek. So you could potentially get more hollow in here as we age. Therefore, you can have more prominent, what we call marionette lines. You can basically get more sagging. So I'm really cautious in recommending buccal fat pad removal unless someone is really fully rounded, and removing the buccal fat pad make it better. One of the things, I'm glad this question was asked, because one of the things I want to just bring out to you is, certainly I'm not a whole lot on social media. I do follow trends, so I want to kind of be able to know what's being recommended. And I would just highly advise you to be careful, because social media can be a detriment in terms of leading someone astray to the wrong for the wrong treatment. Sadly, there's a lot of marketing. There's a lot of treatments that may not be tried and true, and for a consumer or for a patient, they can be easily influenced. And that makes your job even harder, because it can potentially create mistrust. And so I wish I had a better answer than to tell you, just do your research, go with your gut, trust what you hear, trust your relationship with your physician. That to me is really powerful, and be careful of social media. Is there a way not to feel the needles? So no matter what, you will feel the needles. It's just a matter of gently, injecting those needles. I use cannulas as much as I can, but needles, we can numb the face topically. I've tried that, but I find we would have to put the numbing cream for an hour. And the problem with the numbing cream is not only it doesn't quite take the pain away, in some cases, it really hydrates the skin, and it can actually make the lines disappear. So then it doesn't make the procedure accurate in terms of knowing where to inject. So we just kind of go gently, and honestly, it's not an issue for 95% of the patients. If someone can get what's called a vasovagal episode, where they feel like they're getting lightheaded or they're going to pass out, those individuals, I kind of assess them. If I feel there's a potential for that, we always give patients a little pill called Ativan to relax them. So there are ways where we can kind of relax someone. So there are no more questions here. We're done with the webinar. It did take us about 90 minutes. I am so grateful for your time. I appreciate that you stuck around to listen to this. We are here in the office. I wish you all the best in the upcoming next few weeks, months. I hope we stay safe in New York, certainly at large, globally, in the country. I hope everything goes well with the election. And I just, one piece of advice that has helped me is to not try to survive these times, to try to thrive. And the way I would say it's having a positive mindset. I'm careful about what I read or listen to. So I'm so grateful to be able to come to work and get my mind off of what I hear and just try to block the noise. So I meditate, I sort of listen to good things, listen to positive things. So just hopefully you can fill your mind with positive things as well. Anyway, all the best. Thank you so much for joining.